Imagine waking up thousands of years ago with a toothache. Not a small toothache, the kind that keeps you awake, the kind that makes your jaw swell, the kind that turns eating into torture, but there is no dentist, no anesthesia, no antibiotics, no little white pill to make the pain disappear. Just you, your tooth, and a pain that will not stop. So what would an ancient human do? Wait, pray, pull it out, or try something much worse? Today, a toothache feels like a problem you can solve. You call a dentist, you get an x-ray. Someone finds the cavity, numbs the area, cleans the infection, or removes the tooth. It is unpleasant, but it is usually not mysterious. For most of human history, none of that existed. A painful tooth was not just a small medical issue. It could decide whether you slept, whether you ate, whether you could hunt, whether you could travel, and sometimes whether you survived. Because teeth are not simple stones in the mouth, they are living structures. Inside each tooth are nerves and blood vessels. When decay breaks through the hard outside and reaches deeper layers, the pain can become intense. If infection spreads into the gum, jaw, or bloodstream, the danger becomes much bigger than one tooth. Ancient people did not know about bacteria. They did not know about nerves in the modern scientific sense. But they knew pain. They knew swelling. They knew that a bad tooth could make a strong person weak. And long before written medicine, they must have tried whatever they could. At first, the solutions were probably simple. Chew something. Press something against the tooth. Rinse the mouth. Use heat. Use cold. Use plants that numbed, soothed, cleaned, or tasted bitter enough to seem powerful. We have to be careful here. Soft plant treatments do not usually survive in the archaeological record. A leaf, a paste, or a mouth rinse disappears. A skeleton remains. So the earliest toothache treatments are partly invisible to us. But the teeth themselves keep evidence. Sometimes the evidence is quiet. A groove between teeth can suggest repeated picking. A smoothed edge can suggest someone used a tool again and again. A healed abscess can suggest the person survived long after the infection began. That matters because survival itself is evidence. If someone lived with a damaged mouth for years, they were not just lucky. They may have changed how they ate. They may have received help. They may have used small treatments that left almost no trace. The mouth was painful, but it was also treated. They show cavities. They show abscesses. They show heavy wear. They show scratches from toothpicks. They show whether someone lived long enough for an injury to heal. And those traces tell us something important. Ancient humans were not just suffering passively. They were trying to solve the problem. One of the most striking examples comes from Mehrgarh in present-day Pakistan. Thousands of years before modern dentistry, people there were drilling teeth. At this Neolithic site, researchers found molars with small, circular holes cut into them. The teeth date to roughly 9,000 to 7,500 years ago. Microscopic analysis showed that the holes were not random damage. They looked like deliberate drilling, probably made with tiny flint tools. The same kind of drilling technology was used for making beads. So someone may have taken a tool used for craftwork and applied it to the most painful place in the body, the mouth. Imagine that moment. No electric drill, no numbing injection, no sterile dental chair, just a person with tooth pain, another person with a sharp stone tool, and enough trust to let them try. The holes were made in molars, the big grinding teeth at the back of the mouth. Some may have been drilled after decay had already started. The goal was probably not a perfect modern filling. It may have been to remove rotten tissue, open a painful cavity, or relieve pressure. And that is what makes this so strange. This was not just magic. It was not just prayer. It was physical intervention. Someone saw a damaged tooth and decided to work directly on it. That is an early form of dentistry. Not modern dentistry, not painless dentistry, but dentistry in its most basic form. A human problem, a tool, and a desperate attempt to fix it. There is another remarkable clue from Slovenia. A human jaw from about 6,500 years ago had a cracked canine tooth. Inside the crack, researchers found traces of beeswax. That may be one of the oldest known dental fillings. Again, we should not imagine a modern dentist carefully shaping a white filling. This was rough, simple, probably temporary, but beeswax is soft, sticky, and protective. It could cover a crack, it could reduce sensitivity, it could make eating less painful. In other words, someone may have tried to seal the tooth. That is a very human idea. If something hurts because it is open, cover it. If air, food, or pressure makes the pain worse, block the opening. Thousands of years ago, someone may have reached almost the same conclusion without a textbook, but not every ancient explanation was correct. For a very long time, many cultures believed in the toothworm. The idea was simple. If a tooth hurt, something must be inside it. A tiny worm. An invisible creature digging, biting, or eating the tooth from within. Today, that sounds ridiculous, but think about how tooth pain feels. It pulses, it drills, it burns. It can feel like something alive is attacking from inside your jaw. If you had no microscope, no germ theory, and no modern anatomy, the toothworm would not feel like a stupid idea. It would feel like an explanation. Ancient Mesopotamian texts mention this belief, and versions of it appeared in many places for thousands of years. The cure might involve spells, rituals, herbal mixtures, smoke, oils, or attempts to kill the imagined creature. Wrong theory, real pain. And sometimes, even a wrong theory can lead people to try treatments that accidentally help. Plants could reduce pain, oils could soothe, cleaning debris from a cavity could bring relief. Pulling a tooth could end the source of infection, even if the process was brutal. But extraction was not a small decision. Losing a tooth in the ancient world mattered. Teeth were tools. They helped process tough food, they helped tear, chew, soften, and prepare what the body needed. Before soft modern diets, losing chewing power could change daily life. And yet sometimes removal was probably the only choice. If a tooth was loose, rotten, infected, or unbearable, people may have pulled it out with simple tools, fingers, pressure, or force. It sounds terrifying, but an infected tooth left alone could be worse. The story also changes with diet. Early hunter-gatherers did have dental problems, especially tooth wear, broken teeth, abscesses, and cavities in some groups. But farming changed the mouth in a major way. More grains and starchy foods meant more carbohydrates sticking to teeth. That gave mouth bacteria more fuel. In many farming populations, cavities became more common, so as humans settled down and changed what they ate, they also created new dental problems. The same world that gave us villages, stored grain, bread, and eventually civilization also gave many people more tooth decay. That may be why early dentistry appears in Neolithic farming or early farming communities. People were not only living differently, their teeth were suffering differently. So how did ancient humans deal with toothache? There was no single answer. Sometimes they endured it. Sometimes they used plants. Sometimes they cleaned the tooth. Sometimes they drilled. Sometimes they covered cracks with materials like wax. Sometimes they blamed spirits, worms, or invisible forces. Sometimes they pulled the tooth out. And sometimes they probably died from infections that today would be treated in an afternoon. That is the part we should not forget. Prehistoric dentistry was not gentle. It was not safe in the way modern treatment is safe, but it shows something powerful. Pain forced humans to experiment. A toothache could turn a stone tool into a medical instrument, a piece of beeswax into a filling, a superstition into a treatment attempt, a moment of suffering into the beginning of a profession. The first dentists were not people in white coats. They were experimenters, tool makers, healers, maybe family members, maybe desperate patients treating themselves. They did not understand the mouth the way we do, but they understood one thing perfectly. Tooth pain demands an answer. And for thousands of years, humans kept searching for one. So the next time a dentist fixes a tooth with bright lights, clean tools, and anesthesia, remember where this story began, with someone in pain, someone holding their jaw, someone looking at a tooth and deciding that doing nothing was not enough. Modern dentistry did not appear from nowhere. It grew from a very old human instinct. Find the pain, understand it as best you can, and try to make it stop.